So in this session, we'll deal with the histology of urinary system, especially the kidney. So urinary system will have kidneys, ureters, urinary bladder, and urethra. So coming to the kidney, so it purifies blood by ultrafiltration and removal of metabolic waste products. It also performs selective reabsorption. So endocrine functions like erythropoietin, it helps in formation of red blood cells. Renin converts angiotensinogen to angiotensin 1, that helps in blood pressure regulation. So this is performed by juxtaglomerular apparatus. So vitamin D3, the kidney enzyme 1-hydroxylase converts 25-hydroxy vitamin D3 to active 1,2,5-dihydroxy vitamin D3. So this is the structure what we are going to study: the capsule, the cortex, which have cortical tissues and medullary rays, and medulla with renal pyramids and renal columns, and the renal pelvis with major and minor calyces. Each kidney is a bean-shaped organ covered by a capsule. The medial border of the kidney has hilum, through which vessels and nerves enter the kidney. At the hilum, the renal pelvis continues as ureter. The space that occupies vessels, nerves, and renal pelvis at hilum of the kidney is called renal sinus. The renal pelvis is divided into two major calyces, upper and lower. Each major calyce is divided into a number of cup-shaped minor calyces that show conical projections of the kidney, called renal papillae. So the cortex is reddish brown in color due to high vascularity, and the inner medulla is pale. So cortex receives 90 to 95% of the kidney's blood supply, hence it is reddish brown. You can see here is the capsule. These are the renal columns between the renal pyramids in the medulla. So these are the medullary rays. This is the cortex. This is the medulla with the renal pyramids. These are the apical portions of the renal pyramids called renal papillae. And here there will be an area called area cribrosa due to piercing of the collecting ducts. So these are the minor calyces. These are the major calyces. And here you can see the renal pelvis. This is the ureter. And you can see here this is the hilum. This entire thing is the renal sinus. So capsule of the kidney is composed of two layers: outer layer of fibroblasts and collagen fibers, inner layer of myofibroblasts. Renal pyramids are the triangular projections of the renal medulla. The apical portion of the renal pyramid faces towards renal pelvis and base towards the cortex. Renal cortex shows striations. So light lines, 4 into 500 in number, are extensions of medulla into the cortex, and they are called as medullary rays of Ferrin. So medullary rays contain striate tubules of nephron and collecting ducts. The cortical labyrinths are the regions of cortex between adjacent medullary rays. Renal columns of Burton presents cortical tissue that is extended between adjacent renal pyramids. So renal columns of Bettany. So these are the cortical tissues that extend in between the adjacent renal pyramids I have shown here. So these are the renal columns. Papilla is the apical portion of each pyramid. The papilla projects into the minor calyx. Area cribrosa is the perforated area of the tip of the renal papilla due to openings of the collecting ducts. So kidney lobe. Each pyramid with the surrounding cortical tissue forms a lobe of the kidney. Each kidney contains 8 to 18 lobes. Lobulation is a prominent feature of fetal kidney, but in adult kidney, lobes are indistinct. So kidney lobule, collecting ducts of the medullary ray and the surrounding cortical tissue constitutes the kidney lobule. So kidney is having the glomerulus, that is the capillary tuft, and the mesangium. So nephrons, there are three types of nephron: cortical or subcapsular, and juxtamedullary, intermediate or midcortical, and the collecting tubules. So in the nephron, there is Bowman's capsule, which has the visceral layer of podocytes, the parietal layer of squamous epithelium, and the Bowman space. And the renal tubules have proximal convoluted tubule, loop of Henle, and distal convoluted tubule. So you can see here, this is the cortex, this is the medullary ray. You can see this is the glomerulus, and here you can see this will be the Bowman's capsule. So here you can see these are the proximal convoluted tubules with the brush border, and this will be the distal convoluted tubules. These are the medullary rays. You can see these are the loop of Henle. These are the collecting tubules and ducts, and here you can see this is the renal papilla. So you can see here this is the glomerulus with the capillaries and the Bowman's capsule. This is the parietal layer. Here you can see the proximal convoluted tubules with the brush border. So here you can see the distal convoluted tubule, and this here you can see the collecting tubule. So here you can see this is the thin segment of the loop of Henle. Here you can see the ascending limb of loop of Henle, and here you can see the descending limb of loop of Henle. So here you can see the capillaries with the blood. So this is the renal corpuscle, where you can see the Bowman's capsule and the glomerulus with the afferent and efferent arterioles. This is the proximal convoluted tubule. This is the thick descending limb. This is the thick ascending limb of loop of Henle. This is the thin segment of the loop of Henle. This will be the collecting tubule. This will be the collecting duct. These are the collecting tubules. This will be the distal convoluted tubule, which continues with the collecting tubule. So nephron is the structural and functional unit of the kidney. Each kidney contains approximately 2 million nephrons. Each nephron consists of renal corpuscle and the long renal tubule. The renal tubule is made up of proximal convoluted tubule, loop of Henle, and distal convoluted tubule. Distal convoluted tubule connects to the collecting tubule. So based on the location of the renal corpuscle, nephrons are classified as cortical or subcapsular nephrons. The renal corpuscles lie in the outer cortex. They have short loops of Henle that extends only into the outer part of the medulla. Juxtamedullary nephrons, their renal corpuscles lie at the junction of cortex and medulla. They have long loops of Henle and ascending thin segments. They help in the maintenance of urine concentration. Intermediate or mid-cortical nephrons, their renal corpuscles lie in the mid-region of the cortex. They have average length of loop of Henle. So renal corpuscle is a spherical structure. It consists of the following: the glomerulus, a tuft of blood capillaries, Bowman's capsule, the renal capsule or the glomerular capsule, a cup-like double-layered covering of the glomerulus. Urinary or Bowman space, it is a space between two layers of the Bowman's capsule. That's called urinary space. Glomerulus, it is a spherical wall of tuft of capillaries. It receives blood through afferent arteriole, drains into the afferent arteriole. The diameter of the afferent arteriole is less than that of the afferent arteriole. The vascular pole, the site of entry and exit of afferent and efferent arterioles in the glomerulus, is referred to as the vascular pole. Urinary pole, opposite to the vascular pole, Bowman's capsule continues as proximal convoluted tubule. This pole is called as the urinary pole. You can see here. So this is the endothelial lined capillary with the pores. These are the pores. And here you can see this will be the basal lemon of the endothelium, and here you can see this is the basal lemon of the podocytes. That is the visceral layer of the Bowman's capsule with the podocytes and their food process, the pedicles. So these are the slit diaphragms. These are the pores of the endothelium. These are the slit diaphragms. So this forms the glomerular basement membrane. The endothelium, glomerular basement membrane, and the podocytes. So this forms the filtration barrier. Here you can see the mesangial cells. So filtration barrier or apparatus consists of three components: endothelium of the glomerular capillaries. Endothelium of the glomerular capillaries are fenestrated, that has large pores, 70 to 90 nanometers. Glomerular basement membrane, it consists of fused lemon of the endothelium and podocytes of the Bowman's capsule. It forms the principal component of filtration barrier and prevents the filtration of plasma proteins. So few authors describe this glomerular basement will have lamina densa in the center and lamina rara on either side. So visceral layer of Bowman's capsule or podocytes. So the Bowman's capsule has two layers: the outer parietal layer of squamous cells and the inner visceral layer of podocytes. The podocytes have a process called pedicles or food process that extends towards glomerular capillaries. Filtration slits, the elongated spaces 25 nanometers wide between interdistating food process are called filtration slit. It helps in ultrafiltration. Filtration slit membrane or slit diaphragm, it spans the slits between adjacent food process. So glomerular filtration apparatus is a semi-permeable barrier that has discontinuous endothelium and epithelium but continuous basement membrane. So mesangium, glomerular capillaries are held together by mesangial cells in their extracellular matrix. These mesangial cells along with associated extracellular matrix are called as mesangium. Mesangial cells work like pericytes of capillaries and are embedded in the basal lemon of the capillaries. Lassus cells, these are the mesangial cells along the vascular pole, and these cells form the part of juxtaglomerular apparatus. So functions of mesangial cells: phagocytosis of the aggregated protein from glomerular basement membrane, cleaning of the glomerular basement membrane. So support the podocytes and secretion of interleukin-1 and platelet-derived growth factor. So unlike other phagocytic cells, mesangial cells are derived from the smooth muscle cell precursors. Mesangial cells have angiotensin 2 receptors, and these cells help in regulation of blood flow through glomerulus. So juxtaglomerular apparatus is a group of specialized cells near the vascular pole of the renal corpuscle. It consists of juxtaglomerular cells, which are the modified smooth muscle cells in the afferent arteriole, macula densa, which are the modified columnar cells in the distal convoluted tubule, and the extraglomerular mesangial cells, otherwise called Lassus cells. So juxtaglomerular cells, these are the modified smooth muscle cells of the wall of the afferent arteriole. They secrete renin. You can see here this is the JG apparatus. You can see these are the podocytes lining the capillaries. This is the Bowman space. So this is the visual layer and this is the parietal layer of the Bowman's capsule. This is the Bowman space, urinary space, which continues with the proximal convoluted tubule. So here you can see near the vascular pole, this is the afferent arteriole, where you can see the modified smooth muscle cells forming the juxtaglomerular cells which secrete renin, and here you can see the Lassus cells, which are the extraglomerular mesangial cells which form laces-like network, and here you can see the aggregated columnar cells from the distal convoluted tubule forming the macula densa. They test the ionic concentration of the urine here. So decrease in blood pressure, decrease in sodium concentration in blood, stimulation of the extraglomerular cells, secretion of renin, conversion of angiotensin II to angiotensin 1, angiotensin converting enzyme in the lung converts angiotensin 1 to angiotensin 2, and simultaneously there will be secretion of aldosterone from maternal gland, increased reabsorption of sodium and water, increase in blood pressure and volume. So macula densa, these are specialized cells of distal connective tubule that lie adjacent to the afferent and efferent arteriole. Macula densa cells are narrow, columnar and crowded cells. Other than cells of the DCT, they are cuboidal. So nuclei of these cells are crowded and overlapping, hence these cells are called macula densa. Lassus cells are extraglomerular mesangial cells. Mesangial cells near the extraglomerular cells modify to form lassus cells. These cells have lace-like network forming process. So these cells show receptors for angiotensin II and probably regulate the glomerular filtration rate. So macula densa, extraglomerular cells and lassus cells. So here you can see the glomerular capillaries with the mesangial cells, and this is the visceral layer with the podocytes, and this is the parietal layer with the squamous epithelium. This is the urinary space or Bowman space, the proximal convoluted tubule with the brush border, then the thick descending limb of loop of Henle with the brush border, the thin segment of the loop of Henle, the thick segment of the loop of Henle, which is more or less similar to distal convoluted tubule. Here you can see the clearly demarcated cells in the distal convoluted tubule, which continues with the collecting tubule, which is lined by the simple cuboidal to columnar epithelium. And here you can see the simple squamous epithelium lining the capillaries. So the renal tubule consists of proximal convoluted tubule, loop of Henle, and distal convoluted tubule. The renal tubule receives glomerular filtrate from Bowman's capsule at proximal convoluted tubule and continues at distal convoluted with collecting tubules. The renal tubule is lined with simple epithelium, single layer epithelium, proximal convoluted tubule, 40 to 60 microns in diameter. It receives ultraviolet from urinary pole of the Bowman's capsule. It is lined by simple cuboidal epithelium with brush border, central spherical nucleus, and pink cytoplasm, eosinophilic cytoplasm. So in electron microscopy, there will be brush border. These are long, closely packed straight microvilli, tight junctions. These are present in the apical portion of the cell, and basal striations, longitudinally oriented mitochondria give basal portion striated appearance. And brush border and basal striations increase the surface area of the cells. Functions: reabsorption of 80% of the ultrafiltrate, about 150 liters per day. So in proximal convoluted tubule, sodium or potassium, ATPase pump, and aquaporin 1 proteins are mainly responsible for reabsorption of water. So proximal convoluted tubule also reabsorbs the amino acids, glucose, and polypeptides. So thick descending loop of Henle. So it is the communication between proximal convoluted tubule and loop of Henle. Some authors consider proximal straight tubule as part of the proximal convoluted tubule, and some as thick descending loop of Henle. The cells of the proximal straight tubule are shorter than that of the PCT. These cells have less developed brush border, basal and lateral foldings, and less mitochondria than that of the proximal convoluted tubule. The cells of the proximal straight tubule are shorter than that of the PCT. These cells have less developed brush border, basal and lateral foldings, and less mitochondria than that of the PCT. Thin segment of the loop of Henle. The length of thin segment of the loop of Henle is variable according to the type of the nephron. It is longest in juxtamedullary nephrons, whereas shortest in the cortical nephrons. H&D staining. Thin segment of loop of Henle is lined with simple squamous, even low cuboidal epithelium with few microvilli, pale staining cytoplasm, bulging elongated nucleus. It resembles venule in cross section. So thick ascending limb. So it is a part of the ascending limb of loop of Henle. It is lined by large cuboidal cells with light pink cytoplasm and apically located nuclei. So distal convoluted tubule are about 1/3 long as the PCT. So DCT are lined by simple cuboidal epithelium with centrally placed spherical nucleus without brush border. It maintains the function of reabsorption of sodium, secretion, reabsorption of bicarbonate ions. So it works under control of aldosterone for increasing absorption of sodium ions. So PCT, the length is longer, it is shorter, diameter is bigger, it is smaller. Epithelium, simple cuboidal epithelium, darker compared to DCT, lighter compared to PCT. So nuclei fewer, so more equally spaced nuclei. Lumen of the tubule star shaped or irregular, circular or oval. So brush border is present, brush border is absent. So basal striations due to mitochondria present and absent. So here you can see the basal enfoldings with mitochondria in the brush border. Here there is absence of brush border. So collecting tubules 40 to 50 microns. So begin in the cortex. So continuation of the DCT. Proceed to the medullary rays. So medullary ray collecting tubules join to form collecting ducts. So collecting ducts run towards the apex of the pyramid. They join to form the papillary duct of Bellini. Ducts of Bellini open on the free surface of the papilla near the area cribrosa. These are lined by simple cuboidal epithelium without brush border, and it becomes columnar as the duct size increases. So they have clear cells. So these are called CD cells. The cells have single cilium and few microvilli. They have ADH regulated water reabsorption aquaporin 2 channels. So defective aquaporin 2 gene causes diabetes insipidus. These cells show basal enfoldings. The dark cells, these are few. These cells do not show basal enfoldings. And if you come to the blood supply, you can see the renal artery is a branch from the abdominal aorta that divides into segmental arteries, which further divide into lobar arteries. Here you can see the interlobar artery and vein. So they further branch to form the arcate artery. So from that comes the interlobular artery. So here you can see the stellate veins draining into the interlobular vein, and here you can see this interlobular vein draining into arcate vein, draining into interlobar vein, which drains into lobar vein, segmental vein, and the renal vein, and ultimately into the inferior vena cava. So renal artery is a lateral branch of abdominal aorta, then segmental artery, then the lobar artery, interlobar artery, arcate artery, interlobular artery. So there comes the afferent arteriole. Here you can see the afferent arteriole coming from the interlobular artery, forming the tuft of capillaries, then the efferent arteriole. So in the cortex, vasa recta and peritubular capillary plexus drain into interlobular vein. The stellate veins from the capsule also drain into interlobular veins. In the medulla, the vasa recta drains into the arcate veins. Then ultimately, the interlobular veins drain into arcate veins drain into interlobar veins drain into segmental veins, lobar veins and segmental veins, then the renal veins, and directly into the inferior vena cava. This concludes the vasculature of the kidney. Thank you.